Hello everybody, my name is Lady Cantor and today I'm going to share with you some preliminary results on a research that we are developing with Celina Malebran from Chile and Léslie Piccolotto from Brazil. And this research is about work-related voice disorders and how this type of occupational related disorders are regulated in 3 Latin American countries. Before doing that, we would like to share with you some background about work-related voice disorders. So, as many of you can know, the annual prevalence of voice problems among teachers has been reported around 57%, and Roy et al. In 2004 report that around 94% of teachers have suffered voice problems at least one during their lifetime. This implies that at least all teachers have suffered at least once from voice problems during their lifetime. And this is important because if we consider that voice problems are multifactorial, we will also recognize that having a voice problem is not just a health issue, but it is also a socioeconomic problem, and it also has some public health consequences or impact. For instance, in United Kingdom in 2007, it was reported that voice disorders represent around £2,000 millions annually. And in Colombia, a study that was developed in 2015 report that Colombian teachers with voice disorder represent around $458 per teacher per month with voice disorders. With this in mind, it's also important to take into consideration that the word relatedness of voice disorders is depending on the vocal demand response. This means how the teacher is responding to the vocal demand or the vocal demands that their work is putting on him or her. Some aspects that can be related with this vocal demand response are, for instance, the noisy conditions inside the classrooms. But there are also other conditions that should be taken into consideration when the workplace vocal health promotion programs are designed. And just knowing these associated factors, it's possible to take into consideration this information for the designing of these programs and also for the analysis of the economic compensations. This is the reason why we decided to do an integrative review of laws and statistics in 3 Latin American countries. The 3 Latin American countries analyzed were Brazil, Chile, and Colombia. And our main aim was to determine if there was an association between national legislation on work-related voice disorders and the statistics on work-related voice disorders, the national statistics. So let's start with Brazil. In Brazil, there are some strengths related with the legislation, and these strengths are related with the publication of the guideline called Disturbio de la Voz relacionado al trabajo. This guideline was published in 2018, and this DVRT is part of a group of norms that guide protocols to determine the work-relatedness of voice disorders, of diseases, but in specific voice disorders. This DVRT allows to define the assessment criteria and the systematization of statistics. But Brazil has more strengths. They also have something that is called laws of vocal health, and these laws of vocal health aim to guarantee the actions to decrease voice problems, especially among teachers. They also have something that is called networks of caring that helps to organize the knowledge, technologies, professionals, and institutions to guarantee better access to health services. And they also have something that is called reference centers on workers' health that helps to coordinate the promotion programs, address or aiming to offer attention to, for instance, teachers. However, there are also some limitations in the implementation of these guidelines and laws. The first one is related with the identification. And the problem with the identification of the word-related voice disorders is that even though there are some regulations, there are not clear criteria about this identification of word-related voice disorders. The second limitation is related with the notification, and this is related with the fact that it is not clear if suspect cases should be notified, because these could be overrepresent the voice disorders, the occupational voice disorders. And the third one is related with the acknowledgement, because even though it's in the paper, it is not so clear in the reality. Now let's talk about Chile. In Chile, we have that voice disorders are one of the most prevalent voice problems among occupational voice users. This is the reason why, since 1968, there are laws related with occupational voice. The first one that was published in 1968 is the Law 16744. And this law establishes criteria for management of word-related voice disorders. Thanks to this law, there is a definition, an official definition of dysphonia that implies the word-relatedness of voice disorders. This law also helps to organize how to perform the diagnosis and classification of voice as a word-related disease. Later, there was an update of this law, and that was by means of the Circular 3331. And this circular advised the use of protocols to assess voice disorders in the work environment according to the type of job, the type of voice use, and the type of activity. Some indications or suggestions of this circular are related with the analysis of workplaces. According with this circular, the analysis of workplaces should be performed by the speech-language pathologist and should include the analysis of the environment, the room acoustics, the hours of occupational voice use, breaks between classes, and voice assessments in situ and during the occupational activity. Now let's talk about Colombia. Before talking about the legislation, I would like to do a very brief background. Previous studies among Colombian population shows that among school teachers, there is a prevalence of around 71%. And there is also an annual incidence of 44%. This means that during 1 year, around 44 out of 100 teachers can develop a voice disorder, with a low recovery of just 22%. Because this is an important problem for us, in 1984 started the publishing of general legislation about occupational health. And in 2007, we start to talk about how to regulate the occupational examinations. The resolution 2346 says that the occupational examinations should be specific for the job description. This would mean that in the case of occupational voice users, the occupational examination should include perceptual evaluation of voice and acoustic analysis, which is also reported in the literature. In 2014, the decree 1477 says that voice disorders should be recognized as a word-related disease and also make explicit which CIE 10 codes should be included. So these would be the J38 and the R49. With this in mind, we would like to have some conclusions about this review that we did. And the first one is that although there are some laws and guidelines for identification of voice disorders among occupational voice users, there are several aspects that need to be addressed on practice. For instance, the training for occupational voice users on healthy voice use, the interdisciplinary work on the field of occupational voice, and taking into consideration the cost analysis of word-related disorders on decision making. Thank you very much, and thank you to Voice Foundation for this Voice Symposium Online 2020.